streaming live on YouTube. And we are on Facebook.
Freezing up.
Yeah, Facebook's failing right now.
Should we go just
yeah, what would you rather go, YouTube or Facebook? What do you think?
Oh, is that like one of them is failing?
Yeah, I think it's something to do with the CPU. It's like, I think it's just overheating or just being worked too hard.
Okay.
Yeah. Let's see.
Do you want to restart maybe? Restart the computer? Or is it going to be too much?
That would take too long. Let's just go with YouTube since it's Facebook that keeps messing up.
Okay.
Alright, so we're going to YouTube.
Okay.
Alright. Alright, let's try this one more time. Hello and welcome to another edition of Truth with Teeth. Today is October 3rd, 2019. My name is Reese, and as always, I am joined by Dr. Kumar T. Vadivel. Dr. V is a board-certified surgeon practicing as a periodontist specializing in periodontology, dental implants, and oral surgery in the Dallas-Fort Worth area. Dr. V holds a master's degree in dentistry from the University of Minnesota and is a fellow of the Royal College of Surgeons of England and Edinburgh. Dr. V?
Hello there. Thank you so much for joining us for another episode of the Truth with T. We are so privileged to have and honored to have you guys following us on Facebook and Twitter and Instagram and Quora and our website. And we got so many topics to be covered. And as you guys know, this is a place that you can get answers for any tooth questions that you may have. So we are very privileged to be here, and Reese and I are very honored to be here tonight to see what we can do to help you answer many of the questions that have been submitted to us. Thank you so much, and I apologize for the interruption. If you have been watching us for the last few minutes, we had an interruption, technical difficulty, and I'm so glad we are live back again. Thank you.
All right, let's just jump right in and get started. First question comes from Instagram, and it is from Miss Jamie McLean. Question is, should we always hold on to our original teeth?
So the question is, should we always hold on to our original teeth? The answer is absolutely yes. Every single tooth in your mouth you want to hold on to, of course, except for the wisdom teeth. So normally Mother Nature gives anybody about a 32 teeth normally, but the 4 wisdom teeth are like mostly not needed. They usually are troublesome and create problems for many people. So other than the 4 wisdom teeth, you want to hold on to all the 28 teeth as much as possible. So I got all my 28 teeth. I don't have my wisdom teeth. So I'm holding on to all my 28 teeth as much as possible. My recommendation would be you want to hold on to as many teeth as possible. And we say the dental implants are the closest replacement to the natural teeth, which feel, function, and look like natural teeth. Even they have their own difficulty and they have their own challenges. So the bottom line to your answer, the answer to your question, should you hold on to as many teeth as possible? Yes, you want to hold on to as many natural teeth as possible, considering the situation. If you have to die hard to keep a tooth, then that may not be the best scenario. But for the most part, you want to hold on to as many natural teeth as possible.
All right, let's move on to our next question. This one comes from Cora. Their question is, what is the earliest age at which we can remove wisdom teeth?
So the question is, what is the earliest age at which we can remove the wisdom teeth? The earliest age you want to remove the wisdom teeth is closer to possibly like about maybe 13, 14, or maybe if for the girls, and maybe about 14 or 15 for the boys, which is a little bit later for the boys. The reason you don't want to remove them too premature or too young one, they may not have been completely formed, and then the second thing, for example, they may be on the top one, for example, they may be too close to the sinus cavity, and you may not want to end up doing more damage than the good, so you don't want to remove them early enough. And then on the other hand, you don't want to remove them too late either, because if you leave them too long, then you will end up having some kind of a damage that is happening to the other teeth, or maybe the tooth in front of that. So the real sweet spot is around like age between about 14 to 15 or 14 to 16.
All right. So around the teenage years.
Around the teenage years, yes, yeah, around the best time.
All right. Let's go to another question from Cora. This question is mouthwash effective in helping gum disease or just refreshing breath?
So the question is mouthwash effective in helping gum disease or just for freshening the breath? So the answer is, depending on how you use the mouthwash is going to be effective in controlling the gum disease. The reason for that is because the mouthwash is an antibacterial substance. So if you guys go read about what is in the mouthwash, depending on the type of mouthwash that you might be using, they have some antibacterial properties. What that means is they have the ability to control the bacteria, particularly control the bad bacteria more than the good bacteria. So, for example, if you're taking the mouthwash and then you're sipping it and then you're swishing it for like maybe about 2 seconds and then you're spitting it out, then you may be using it for freshening your breath. However, if you want the mouthwash to be effective enough and you want to be kind of swishing it around your mouth and you want to keep it in your mouth for at least like a minimum of about 30 to 60 seconds. So the way these mouthwashes, most of them work, they actually stick to the gum line and they stay under the gum line and all of that good stuff to be able to have the maximum effectiveness. So if you are going to use the mouthwashes at the manufacturer recommendations, then you are going to have the maximum effectiveness, which is the antibacterial property of the mouthwash. Then they are going to help control the gum disease, versus if you are going to use it just for a few seconds, then you are going to only use it for the purpose of refreshing your breath. So if you are using it at the manufacturer recommendation, then you're getting the maximum effectiveness of controlling the bacteria as well as refreshing your breath.
Oh, okay. All right, let's go to Facebook for a question. Let's see, their question is, I need a payment plan. This one is from Tiffany. What can I do?
So the question is, I need a payment plan. What do I do? So if you happen to be in the Dallas-Fort Worth area, come visit our office, Implants and Gumcare. We got several payment options, as you know, Reese, so we can offer it to you. Or if you happen to be at a dental office, talk to them about the many payment options they have. I can kind of give you some generic idea of what kind of payment options that most dental offices offer. One of the most popular payment options most dental offices offer is what we call it as a care credit. So you have care credit, and also you have something called lending club. So those are the two third-party payment options that you have at a dental office. And many of the dental offices, they have some in-house payment option. For example, just like paying Netflix, I say, they have the ability to charge your credit card on a monthly basis, or they have the ability to charge your debit card or your bank account on a monthly option to offer a payment plan. So we call it as an in-house payment plan. And then we do have, in addition to these third-party financing options and the in-house payment options, some offices, they have it's kind of like, for example, the layaway option the Walmart offers, particularly around the Christmas time or the holiday time. So you have the ability to prepay the dental office for any type of treatment that you may need. So my recommendation is, if you are looking for a payment option, depending on the type of treatment that you need to talk to your dental office or your dental specialist office to see what they can do to help you. Again, if you happen to be in the Dallas-Fort Worth area, come see us or visit us at implantsandgumcare.com to see the various payment options that we have.
Mm-hmm. Yeah, and if you're really struggling and you need some work done, come on by and we'll work with you and try and get you a good deal.
Thank you, Reese. Appreciate it.
All right, let's go to Cora for another question again. Let's see. There we go. With so many dentists promising same-day implants, why do implants at dental schools sometimes take as much as a year?
So the question is, with so many dentists promising same-day implants, why do implants at dental schools sometimes take as much as a year? So the bottom line is, there is no single answer, or there is no magic answer to, okay, the dental implants are going to take about 3 months. And I got patients in my office and we do some implants same day, and they come in and they take the tooth out and we place the implant. Sometimes we place the crown on the same day, or they say come in with a bunch of bad teeth and we remove all the teeth and we place the prosthesis on the same day. And I got patients, it has taken not just a year, sometimes it takes up to 2 years or up to 3 years to do this the implant. So there is no real cookie cutter answer to why this implant is taking the same day versus why it is taking 3 years. It really depends on the condition of your mouth. If you have some severely infected teeth and severely infected mouth, and it may take 6 months to a year to get your mouth into shape or get your bone into shape before you receive the implant. Let's say you take about a year to get your bone into shape before you receive an implant. Then after you get your mouth into shape, after you place the implant, it may be another 3 to 6 months before you receive a tooth or a prosthesis. Say, here we go. It takes about a year and a half. Let's say you receive an implant, then the implants fail for whatever reasons, then you have to remove the implant and you have to redo the bone grafting, and you wait for another 6 months to a year before you receive another implant. Here we go. The process gets doubled, and that's why now it is taking about a year and a half to now it is going to be 3 years before you complete the implant treatment. So the answer to your question, yes, some instances we are able to do the implants the same day in 1 day. Some instances the same implant is going to take over a period of 3 years, up to a period of 3 years, and it really depends on the situation, and I hope this answers your question.
All right, let's go to another question from Facebook. Let's see, let's go for this one comes from Josephine Washington. She would like to know, which insurance do we accept?
So the question is, which insurance do you accept, or do we accept? We accept pretty much any PPO insurances in our office. However, are we able to help patients with a non-PPO insurances? Yes, we do. We work with patients all day long, patients who have discount plans, who have Medicare, who have no insurance at all, who want to be on a payment plan. So we do have a variety of payment options for patients who do not have insurance, or who do have PPO insurance, or who you may think HMO plan that you may have. So the answer to your question is, don't worry about whatever insurance you may have. Just give us a call and Reese may be answering the phone when you when you call our office. We are able to help any type of insurance you may have. And the bottom line is, you may be thinking you may have an insurance and you may not know the insurance that you carry has no coverage for the type of procedure that you do. How do you know? So you give us a call, and you have no obligation to pay anything to our office, because all our consultation and our CAT scan comes for free. And when you come in, we will find out what benefits do you have. Depending on the benefits you have and depending on the treatment plan that you need, then we will come up with a possible payment option or a solution to just how you can help fit your budget, and then we'll go from there. And I hope this answers your question. Then you will have the ability to call our office to make an appointment.
Yeah, bottom line, if you have any questions about insurance, forget about that. You have a dental issue, you need to come on in and we can get you that treatment plan, see exactly what you need done, and Dr. V will present you with some financial options that'll really work with you.
Thank you, Reese. Yeah.
All right, let's go to another Instagram question. This one comes from MJ. Their question is, I had a root canal performed in April. Not sure if I made the right decision with this gap.
So the question is, I had a root canal performed in April. Not sure if I made the right decision with this cap. So I'm assuming that the patient had the root canal treatment, and you had the root canal treatment, and you were recommended a crown or a cap to be performed after this root canal. And my assumption is you may be having some problems with this crown or the cap you have, and without seeing it, of course, I cannot tell you what is going on with this cap or the crown. My recommendation is you speak to the dentist whoever made this crown for you, and they should be able to answer this question. And if you are not happy with the way the crown was made, and if you are looking for somebody else to give you another opinion, if you happen to be in the Dallas-Fort Worth area, come on in. And as you know, we have a free consult and a free CAT scan. We will be able to help you. If you're not happen to be in the Dallas-Fort Worth area, go see a local dentist, and many dentists offer a second opinion, and they should be able to happily answer any questions that you may have, whether you made the right decision with moving forward with this root canal or moving forward with this crown. And I hope this answers your question, and somebody should be able to help you.
All right, let's go back to Cora for another question. Let's see. All right, next question is, I have a yellow line on my gums that hurts whenever I eat. What could it be?
So the question is, I have a yellow line on my gums that hurts whenever I eat. What could it be? So the most common thing that I see when patients are complaining about the yellow line is what we call it as a tartar. The tartar is the most common yellow line that we see, and it seems like from what you are describing, you may not have had a chance to visit a dentist for a long period of time. That's when we see the plaque or the food that you eat builds up into becoming a tartar. So when you have tartar, that is an indication, which is the yellow line that you're talking about, a start of a severe gum disease. So before it becomes severe enough to make you lose your teeth, my recommendation is you see a dentist or a periodontist to see what is going on, so you don't end up losing your tooth. So the bottom line, the answer to your question, the yellow line that you see on your teeth is tartar, and I strongly recommend you go see a dentist or a periodontist in your area.
Yeah, if you're in pain, you need to be seen immediately. You don't want to be in that anymore.
Absolutely. Yes, sir.
All right, let's keep rolling with Cora. All right, let's see this one. So next question is, does a severely broken tooth require a cap or extraction?
So the question is, does a severely broken tooth require a cap or an extraction? And of course, without seeing a tooth, I can't tell whether you can manage with a cap or a crown, or you require an extraction. The bottom line is, from what you're telling me, if the tooth is severely broken, or if a dentist has already told you the tooth is severely broken, then the tooth requires an extraction. If you're starting to see some kind of a chipping on the tooth, it can be easily fixed with a cap or a crown. So if you have not seen a dentist, I recommend you immediately go see a dentist, and before it becomes a severe problem, then you may be able to fix that tooth with a crown. Or in your mind, if you have already been to a dentist and if the dentist has already told you that tooth requires an extraction, then more than likely you require the tooth to be extracted. And my recommendation is, you not only think about extracting the tooth, I highly recommend you extract the tooth and replace that tooth with a dental implant. So either you need a crown or you need an extraction and an implant. You talk to your dentist about the options and choose the best option.
All right, let's keep going on. Let's see. Next question, number 17. How do old people lose all their teeth? How can I prevent this for myself?
So the question is, how do old people lose all their teeth? How can I prevent this for myself? So it is not a question of losing one or two teeth. This person is concerned about losing all the teeth. It could happen for a variety of reasons. It's just not one reason. It could be from a variety of reasons. For example, most common reasons that we see in our office, people are not visiting the dentist on a regular basis. People have severe gum disease. People have broken teeth from the cavities. People are wearing partials or partial dentures, and the partial dentures could be damaging to their teeth. So these are the most common reasons that are one of the reasons people are medically compromised, meaning like they got some medical conditions that are making them lose their teeth. So these are all the reasons, that some of the most common reasons that we see make people lose all their teeth. And how can you prevent this from happening? The bottom line is, you got to go see a dentist. Not that you go see a dentist once or twice in your lifetime. You go see a dentist on a regular basis. Most patients, particularly if you are an older patient, we recommend you see a dentist 4 times a year, and of the 4 visits that you will need, and our recommendation is you see your dentist as well as you see a periodontist or a gum specialist like me. And particularly if you are concerned, in your case, you should be seeing your family dentist twice a year, and then you should be seeing a periodontist or a gum specialist like me twice a year, alternating every 3 months. So if you are going to follow that recommendation, then you could be keeping your teeth possibly for the rest of your life, and you could be preventing the problem like losing your teeth for yourself. And I hope this answers your question.
All right, let's keep right over here. Let's see. Next question is, what precautions or instructions need to be followed before and after a wisdom tooth extraction?
So the question is, what precautions, instructions need to be followed before and after a wisdom tooth extraction? So the real answer is not just one. There are tons of instructions that need to be followed before an extraction. and there are tons of instructions that to be followed after the extractions. These are all related to the recovery or how successful your procedure could be. So the bottom line is, in our office we have a set of pre-surgical instructions we recommend for our patients. There is a set of post-surgical instructions that we recommend our patients follow, and these are like a 2-page document, like a front and back for pre-surgical, again front and back for a post-surgical. So if you happen to be in the Dallas-Fort Worth area, come see us, and how you could prevent problems with your wisdom teeth extractions, how we can successfully help you do these extractions. And if you're not in the Dallas-Fort Worth area, go to our website and look for the pre and post-surgical instructions, or under the patient section you should be able to see all of that. If you happen to Google the post-surgical, pre-surgical extractions for wisdom teeth, pre-surgical instructions for wisdom teeth, or post-surgical instructions for wisdom teeth, and you should be able to get all the instructions that you need. And if you follow all those instructions pre-surgically as well as post-surgically, you should be making your recovery process and your surgical process as easy as possible and as successful as possible. And I hope this answers your question.
What do you think is the most important thing to think about pre and post surgery?
Well, one of the reasons why patients I commonly see ask those questions is because they're more worried about the dry socket. So the dry socket is one of the most common problems we see after the wisdom teeth extractions. And patients, if they're smokers, and you need to start thinking about how you're going to quit immediately before and after the procedure. And if you're using a straw, for example, which could be causing the wisdom tooth, and if you're a soda drinker, heavy soda drinker, you got to plan for how you're going to stop using the soda or stop using the straw to prevent the instructions. And sometimes patients don't follow the instructions of how they should be managing the post-operative pain. And in our office, as you know, we give you a stronger pain medication as well as the regular pain medication. And also we also give patients an antibiotic. And if you're not following how you're going to be taking your prescriptions, then that could be a problem. So these are kind of the common instructions that we see. Like I said, not just one. There are multiple things that you need to be following that would help you make your wisdom teeth extraction safe and effective and successful as possible.
All right. Let's go back to Facebook for another question. Let's see. Keezy McCrae would like to know, what are all the options for missing tooth? All of them.
So what are all the options for missing tooth? So the question again is, the question is, what all are the options for missing teeth? So depending on whether you have one missing tooth or you have all missing teeth. So say for example, if you have one missing tooth, let's say this is a front tooth, for example, you may or may not be able to see is in this model, but if it is a one missing tooth, after this one missing tooth, once the tooth is removed, now you have the option to go with no tooth at all, or you have the option to get what we call it as a partial denture, which is a flipper, and you have the option to do what we call it as a bridge, which means soldering down the two teeth on either side and get a bridge, or you replace the tooth with an implant, which is the best way to replace the tooth, which feels, functions, and looks like a natural tooth. These are the options for either one tooth or a few missing teeth. If you have all missing teeth, now you have other options, which will be like this denture. If you have all missing teeth, now you can get a denture like this, right? And the other option, instead of doing the regular conventional denture, is what we call it as a snap-on teeth, or a locator type denture, a snap-on denture. So you have implants here, and then you have some snap-on teeth. That is another option. Or if you don't want to have a removable option, now you have option like this. This you have completely fixed teeth. So to go back to your question, so if you are looking for an option that is removable, then you go for dentures, either a partial denture or a full denture. Or if you are looking for a permanent fixation or a non-removable option, then you go for an implant, either with a single or multiple teeth, or you got a full set of teeth that are implant retained that you don't have to ever remove.
Okay. All right. So let's go back to Cora for our next question. Let's see. What are the tips I should follow to experience a good dental treatment?
So the question is, what are the tips I should follow to experience a good dental treatment? So if you want to follow a good dental treatment or experience a good dental treatment, you got to stick to what your dentist is saying pretty much, because I don't know really the type of treatment that you need. So depending on, for example, if you are getting a dental implant from me, and I'm going to give you several tips to experience a good dental treatment. For example, how successful that dental treatment is going to be. If you are going to follow my tips, then you are going to be very successful, and the outcome of the treatment is going to be very successful. So the answer to your question is, depending on the treatment that you are going to need, your dentist is going to recommend what you should be following or what their recommendations are, and my recommendation is you follow the recommendation of the dentist, whoever is recommending the treatment, so your treatment is going to be successful. And I hope this answers your question.
All right, keeping with Cora. Next question. How should I take care of my coming wisdom teeth through my gums?
So the question is, how should I take care of my coming wisdom tooth through my gums? So I guess you're asking, how do you take care of a wisdom tooth that is coming through my gums? So the real answer is, at some point you're going to need the wisdom tooth to be removed, and sounds like you're possibly young enough, because that's why the wisdom teeth are pushing through your gum line. Bottom line, you need to have the wisdom tooth removed, and from the sound of it, looks like the wisdom teeth are impacted, which means they may or may not come through fully. Even if they do come through fully, you may still end up having some long-term problems and complications. More than likely, these wisdom teeth need to be removed, and my recommendation is you go see an oral surgeon or a periodontist like me, or somebody specializing in oral surgery or a periodontal surgery like me, and we should be able to help you remove the wisdom teeth to prevent any kind of problems. That way you don't have to worry about, oh, what am I going to do? The wisdom teeth are coming through my gums. Hey, what am I going to do? The wisdom teeth are now coming through not only coming through my gums, but they are starting to hurt me. So before anything happens, we say prevention is better than cure. Before anything happens and you go see a dentist or a periodontist or an oral surgeon, they should be able to help you remove your wisdom teeth or take care of your wisdom teeth. And I hope this answers your question.
All right, let's keep going. Next question is, what causes my teeth to be chipped at the gum line? What treatments can be used for a chipped tooth?
So the question is, what causes my teeth to be chipped at the gum line? What treatment can be used for a chipped tooth? So from this question, it seems like your tooth is completely broken off at the gum line, and of course without seeing you I cannot predict what is happening, but at least I can sense this, that your tooth is completely broken off the gum line, and I really don't see any other treatment other than removing a tooth and replacing it with a dental implant or a partial denture or a dental implant bridge. And of course you can go without a tooth, but if your tooth is completely chipped off at the gum line, your options are you need to go see a dentist to replace this tooth, or at least not even replacing it before it becomes a problem, before it gets infected. You need to at least have the tooth removed, and your dentist can talk to you about the replacement options. And I hope this answers your question.
All right, let's go back to Facebook for another question. This one comes from Kurt Young. His question is, I need help with gum disease and implants. What are my options?
So the question is, I need help with gum disease and implant. What are my options? So if you already know, or you have been told that you have gum disease and you need implant, you need to be seeing a periodontist or a gum specialist like me. If you happen to be in the Dallas-Fort Worth area, visit us at implantsgumcare.com and make an appointment or call our office, and you should be able to see the phone number. If you need Google our number or Google our name or Google Implants and Gumcare in Carrollton, Texas, and we should be able to help you. But if you already know that you need gum disease and you already have gum disease and you need implants, my recommendation is you go see a periodontist locally, and then they should be able to help you. And I hope this answers your question.
All right, back to Cora for another question. This one is, what causes bad breath after wisdom teeth removal? How is this to be treated?
So the question is, what causes bad breath after wisdom teeth removal? How is this to be treated? So there are a variety of reasons you could be having bad breath after wisdom teeth removal. It could be as simple as the recovery procedure or recovery process is going to cause some bad breath, and you just cannot prevent that. It is just a part of the process. It is just the beauty of the beast. You cannot do anything about it, and you just move along and follow the recommendations of the dentist, and once the recovery process is over, and you may not have bad breath. However, if you're seeing signs of infection, you got a dry socket, you got a little bit of a more bad breath than you could anticipate. And for example, if you feel like you started with a little bit of a bad breath, now you're starting to have some severe bad breath, then you need some attention, meaning you need to go back to the dentist or to your surgeon to talk about whether you have some infection or a dry socket which could be causing your bad breath. So the bottom line is, bad breath sometimes is not preventable after the wisdom teeth procedure because it's part of the process, so you don't need to worry about. But if your bad breath is getting worse, then you need to go see the dentist or periodontist or the surgeon whoever removed your tooth. So don't worry about it just because you have the bad breath after the wisdom tooth removal. But if it seems to be getting worse, then talk to your dentist and they should be able to help you. and I hope this answers your question.
All right, let's see. Next question is, if there is not enough bone for a dental implant, what are the things one needs to be careful of when undergoing a sinus lift?
So the question is, if there is not enough bone for a dental implant, what are the things one needs to be careful when undergoing a sinus lift? So the bottom line is, what the reader is asking is, what do I need to do? I don't have enough bone. I need to get an implant, and I've been told I need a sinus lift. What do I need to be careful before undergoing a sinus lift procedure? In our office, we got actually a 4-page document that explains, the 2-page document of the 4 explains the pre-surgical instructions. The 2 other page document that explains the post-operative instructions. So there are multiple things that you need to be careful before undergoing a sinus lift procedure. So there is not just one thing. So depending on the type of procedure or the severity of the sinus lift, your surgeon or your periodontist or your dentist specializing in these kind of procedures should be able to outline what are the things that you need to be careful about before or after going through this procedure. And again, my recommendation is you talk to them about your specific condition, and they should be able to help you. And I hope this answers your question.
All right, let's go back to our Facebook questions, our final one from the night from Facebook. This one comes from Arlene Douglas. Their question is, I need my mouth done so bad, and it's been some years. It has caused bad breath, and I don't want to open my mouth. What should I do?
So the question is, I need my mouth done so bad, and it has been some years. It has caused bad breath. I don't want to even open my mouth. What do I do about it? So, from the sound of it, you have not had some dental work done for some years, and from the sound of it, looks like you have not seen a dentist. So, the bad breath that you are experiencing could be caused by a variety of reasons. It could be the broken teeth, or it could be a bad denture that you may be wearing, or a bad partial denture you may be wearing, or it could be the severe gum disease that you may have contracted from not going to the dentist for several years. So the bottom line is, to answer your question, you need to go see the dentist as soon as possible. Once you go to the dentist, they may be able to evaluate your bad breath. Could be due to some decay or the cavities or the gum disease, or could be from a partial denture. Once they evaluate the reason for your bad breath, they should be able to give you the recommendation of what the treatment course should be. And depending on the course of the recommendation, you should be able to make some decisions to improve the bad breath, and I hope this answers your question.
All right, back to Cora for another question. Let's see. What are some reasons my gum line might be itching?
So the question is, what are some reasons my gum line might be itching? So one of the most common reasons why patients feel like the gum line could be itching is the gum disease, or some patients call it gingivitis. So think about this. The gum disease or the gingivitis is caused by the bacteria. It is a bacterial disease. When the bacteria are crawling or they are going under your gum line and they just keep moving around underneath the gum line, they're essentially kind of creepy, right? The bacteria are creepy, or when they're crawling and you feel like they are being creepy and there is so much bacterial movement under the gum line. When these bacterial movement happens under the gum line, either because you have gingivitis or some kind of periodontal disease, this is what most patients describe as the gums are itching. Of course, without seeing you, I cannot tell you whether you have gum disease or gingivitis or not. I can only comment on what most patients are describing to me as itchy gum line. When patients are feeling like they have itchy gum line, the most common thing that I see is either they have gingivitis or they have some kind of a periodontal disease happening. So my recommendation is, based on what you're telling me, you may have either gingivitis or you may have some kind of a periodontal disease or a gum disease, and you need to go see a dentist. And it could be as simple as you may need like a regular cleaning, a routine preventative cleaning that is going to fix the itchiness that you have on your gums, or it could be that you need the deep cleaning, and the dentist should be able to help you even with the deep cleaning. It could be a simple deep cleaning that should be able to fix the itchiness that you're feeling. So go see a dentist and they should be able to help you. And if you happen to be in the Dallas-Fort Worth area, come see us at Implants and Gumcare and implantsandgumcare.com. You should be able to make an appointment and we should be able to help you. And I hope this answers your question.
All right, looks like we have time for maybe 2 more questions. So let's do another one from Cora. This question is, this is my first oral surgery. Should I remove 2 wisdom teeth instead of 4?
So the question is, this is my first oral surgery. Should I remove 2 wisdom teeth instead of 4? My recommendation is always to get all 4 wisdom teeth removed at one time and be done with it. This is going to be the most simple thing that you could be doing for yourself, the most help you could be doing for yourself, and most favor that you could be doing for yourself. And think about this, when you're removing 2 wisdom teeth, you're going to go through the recovery process, and if you're going to get the 2 other wisdom teeth removed on another occasion, you're going to go through the recovery process again. And if you're going to be put to sleep to get the 2 wisdom teeth removed, more than likely you need to be put to sleep again to have the other 2 wisdom teeth removed. For the most part, when patients are asking me this question, I'm telling them, by not removing all 4 wisdom teeth in one appointment, you're almost kind of doubling everything that you are doing. So the real answer to your question is, when patients ask me, should I remove 2 or 4? I always, 99% of the time, I always, 100% of the time, recommending all 4 wisdom teeth at one time. No questions asked. If you have all 4 wisdom teeth, and if all 4 your surgeon is recommending, you need to have all 4 wisdom teeth removed. No second thoughts at all. Get all 4 wisdom teeth removed one time. You can't go wrong with that at all. So I hope this answers your question.
Yeah, removing all 4 instead of 2, they'll probably save some time, money, and a lot of pain.
And suffering, yes sir. And an easy recovery also.
All right, last question. Let's stick with the wisdom tooth one. Number 18. How can wisdom teeth cause swollen lymph nodes?
So the question is, how can wisdom teeth cause swollen lymph nodes? So from the sound of it, it looks like you have been told either by your dentist whether you have some swollen lymph nodes, or you may have even gone to your primary care or an ENT surgeon, and the ENT might have told you that you have some swollen lymph nodes, or your primary care might have told you you have some swollen lymph nodes. Here is the deal: whether you have a top wisdom tooth or a bottom wisdom tooth or any other teeth for the fact, they're all connected, they're all wired together to the lymph nodes in the face or the head or the neck. So when you have something going on with your wisdom teeth, or not only the wisdom teeth, any other teeth, they are going to drain, or your lymphatic system or your immunity is going to fight against this type of infection you have with any other, with the teeth or wisdom teeth, and they are going to drain into the lymphatic system or drain into your lymph nodes, particularly the ones underneath your jawbone, and more than likely you are going to feel or you're going to see some swollen lymph nodes, and that is what you're experiencing, which is not uncommon at all. So if your dentist or your surgeon or your periodontist has told you that your swollen lymph node is related to your wisdom teeth, my recommendation is get them out, and you could definitely see some relief on the swollen lymph node. And I hope this answers your question.
All right, well, that does it for us tonight.
Hey, thank you so much, folks, for joining us for the Truth with Teeth show tonight. And we are so privileged to have you guys follow us. And please submit your questions from our website, or Quora, or Facebook, or Instagram, and we sure will be able to answer the questions at our next live show. And thank you so much for joining us, and until next time, and take care, folks. Thank you so much, and thank you, Reese.
We'll see you later.
And thank you, sir. Appreciate it.